My name is Miss Yvette, and I am from Sierra Nevada Home Health. We are a local home health agency that is privately owned by the Perrymans, Jonathan and Noelle Perryman. And they have lived here in Reno since their teenage years, and they are they come from Northwest Reno, so they know the community, and they really care about what they do. One of Jonathan's constantly saying, nobody cares how much you know until they know how much you care. And we have found that we're able to find some amazing nurses, physical therapists, and occupational therapists that agree with us, as well as our CNAs. We provide skilled nursing, physical therapy, occupational therapy, speech and language pathology, social work, and certified nursing assistants. Now, who here is familiar with home health? Oh, okay. Well, home health comes to you. You could have an injury, or you picked up a gallon of water the wrong way and threw out your back. You slipped on your stairs and hurt your knee, and you opted for home health. We come to you. So our services are provided in your home at your calendar, your schedule. So we work around your schedule in order to accommodate you. We can bring in physical therapy, again, occupational therapy. Occupational therapy comes in and we do a safety eval. We want to see if you've got any slip rugs or any small pets and fur babies that might get in the way, and just help keep you safe at home. We want you to be as independent and as mobile as you can be, and that's our goal with home health. How do you get home health? Well, you go to your primary care physician and you let them know that you want some assistance at home. It's not a PCA service. It's not someone who comes for a couple of hours and sits with you and does light housekeeping and things like that. It is a skilled need. How do we get around that skilled need? With preventative therapy. Home health is also preventative. You don't have to wait to have an injury or an ailment to get on home health. We can come in and tune you up. We have a Sierra Nevada tune-up program, and that's to keep your joints and your balance and check your gait. And again, with occupational therapy, coming in and seeing how safe your home is. Do you need some extra grab bars? Do you need some durable medical equipment? What's that? Well, that's a shower chair, that's an overbed table, that's a walker, a cane, potentially a wheelchair, knee brace, whatever you might need, again, to stay as independent and as mobile as you can be. Everyone wants to age at home. And with home health assistance, you can do that. And you can do that for as long as you can, and we can help with placement as well. So we have some additional programs that we provide, certified wound care, orthopedic program, catheter care, lymphedema management. We have a lot of different programs at Sierra Nevada Home Health, primarily because our owners care about the community. We just started a Sierra Nevada Cares program, and that's to offer free DME services to anyone who needs it. Typically, your insurance does pay for all your DME needs when you're on home health. Your doctor can order you different items, but there are some items that maybe your insurance doesn't cover or you can't find. We can do that for you. Anyone on this list is going to be a good resource for you. Your speakers here today, they're going to be able to point you in the right direction, but we also want to be able to utilize the different resources that we are aligned with out in the community. The Care Chest of Northern Nevada, they give away DME, but you have to fill out some paperwork, and some of our patients don't have IDs. They've lost them over the years. And so it creates some barriers out there to getting what you need, and we have decided to fill that gap and be able to help the community as much as we can. So we're here to help, and I love being a resource for patients. If you have any questions, if you need anything, the answer is always no if you don't ask. Right? So please give one of us a call, and if we can't help you, we can point you in the right direction and get you the help that you need. Let's see what else do we have here. As I mentioned, we do order all the required adaptive, durable medical equipment for you, including glucometer and finger sticks for you diabetic patients. You know, our nurses come out and can do med management and disease management, and there are so many different elements to home health. My one takeaway is don't wait until you need home health to start looking for home health agencies. You are going to develop relationships with different people in different ways. Some agencies are just going to click with you. You know, don't wait until you're in a hospital or a doctor's office and they're like, which agency would you like to go to? Interview. There's several out there. And your family and friends, somebody knows somebody, right? So get ahead of it, you know, so that you don't have to make that rash decision or feel like you're being led into a different direction. You do have the opportunity to choose your healthcare providers, right? So although your orthopedic surgeon may say, you know, this agency, I work well with them, well, I want to talk to a couple of them. You know, you have that choice. That's one takeaway that I'd like you to take away from this is that your healthcare is your decision. And choose your providers wisely, right? All right. We can address and prevent 5 centennial events that typically result in an ER visit. That's UTIs, falls, constipation, upper respiratory infections, and wounds. What does that mean? Well, these 5 events are what will cause you to go to urgent care or an ER. Home health, we can come and do the labs right in your home. We can come and do the wound care in your home, keep you out of urgent care, keep you out of the hospital, and again, keep you as mobile and as independent as you currently are. All right? Does anyone have any questions for me? Yes, ma'am.
You don't, when I call you, you don't have, my primary care doesn't have to know.
Oh, no, we will reach out to your primary care and let them know that we need an order from your primary care for home health. They'll want to know, you know, what are you going on home health for? Well, I want a tune-up. I want to get physical therapy in my house and I want to work out this kink I've had in my knee before I'm walking one day and all of a sudden my leg gives out on me. So we do have that preventative maintenance program and we're one of the only home health agencies that has that right now. Anyone else?
So for URI, UTI, you'll be able to prescribe medications?
Absolutely. We have a medical director and our nurse will come out and they will do that UTI test. And if it's positive, they'll call the medical director. We'll get a prescription for you and have that delivered to your home within a couple of hours. So think of it as I can sit in urgent care for a couple of hours or I can wait for the meds to be delivered to my home in a couple of hours. Yes, sir.
If you need some sort of surgery, and after the surgery you need rehab.
Correct.
And your surgeon recommends a rehabilitation place for you or someplace to go to get the exercises done and everything. What would be the difference between that and someone coming to your home, aside from them coming to your home? Is the cost the same? Is the care the same?
Well, when you go into a skilled nursing facility, because that's where you would be in a rehab, you would be in a facility.
Okay, I used the wrong term. I don't mean rehab. I mean, again, I had shoulder surgery.
Correct.
And I need to go for therapy, for physical therapy.
Correct.
Okay, so there's the physical therapy that you bring into my home. Is it the same physical therapy I would go to that in a facility that
Correct.
my doctor would recommend?
Right. You
And
can.
if so, is the cost the same? Is it different? Is it covered differently?
Well, that's a good question. I would say that if your doctor prescribed physical therapy for you, they could prescribe it with someone like a physical. You would go to an outpatient clinic and you'd schedule your appointments with them. Your insurance would provide that coverage.
Correct.
Yes, it's the same coverage for physical therapy, correct? It depends on your insurance to know whether or not you have a copay associated with that or not. Most insurances cover home health. You know, you need it after a surgery as rehabilitation for that. So what we would do is the difference between going to an outpatient therapy is making an appointment, getting in your car and driving there, and there's some very good outpatient therapy clinics. You're going to hear from one today. And then the other option is maybe that physical therapy, you're going to have a hard time driving with your arm or if your knee is injured. It's not an easy, transportation is not easy for you, home health might be an option. Where we come to you, we work around your schedule. It's the same duration, I believe. Going to an outpatient therapy, you'll have an hour of physical therapy, and we come to your home, we provide that same hour of physical therapy. I think the biggest difference between going to a clinic and getting home health is an entire team approach where you have social work and CNAs. CNAs can help you with anything that you need in your home in terms of making you a sandwich and putting it in your refrigerator for something for later. Helping you with bathing or changing your bedding. Because your arm is in a sling or your knee is in a brace, you might have difficulty doing those simple day-to-day activities. And because we have our whole team coming in, we'll be able to help you in your home versus going to a clinic and just being getting provided that physical therapy there. Does that make sense? Okay. Anyone else? Well, I really appreciate your time today. I have lots of information and flyers at my little table display with a list of insurances and areas that we go to. And it is a quick postcard for you, not too much to put in your bag. But please enjoy lunch, and we'll take a quick break, and then we'll come back and you'll hear from the rest of our presenters. Thank you so much.